This is the video on the embryology of the nervous system. The first thing an embryo needs to do is define its axes, which are front-back, top-bottom, and left-right. Front-back is ventral-dorsal, top-bottom is anterior-posterior, and left-right is left-right. Without the axis, the embryo cannot develop in the normal manner. Shortly after the axes are defined, a notochord develops along the dorsum of the embryo. The cells on top of the notochord start to curl upward, eventually forming a tube called the neural tube. This happens by the third week of fertilization for a human. The neural tube is open on both ends, but over a few days, both ends close. During the fourth week, the tube then begins to form three bulges: the prosencephalon, the mesencephalon, and the rhombencephalon. The remaining caudal end will become the spinal cord. These three bulges change during the fifth week of gestation to form five bulges that start to fold over themselves. The prosencephalon becomes the telencephalon and the diencephalon. The mesencephalon remains the mesencephalon, and the rhombencephalon becomes the metencephalon and the myelencephalon. The major segments of the brain and spinal cord have developed. The telencephalon morphs into the cerebral cortex, basal ganglia, and amygdala. The diencephalon morphs into the thalamus, hypothalamus, and produces two bulges that become the retina. The mesencephalon is the midbrain. The metencephalon becomes the pons and cerebellum, and the myelencephalon morphs into the medulla. Around the time the neural tube is forming, small sections of nearby cells differentiate into structures called somites. In this picture, 2 is the neural tube, and 3 is the somite. These paired structures line both sides of the neural tube. These morph into sclerotomes, which become bone, myotomes, which become muscles, syndotomes, which become the cartilage and ligaments, and the dermatomes, which is the skin. Nervous tissue and skin both are derived from ectoderm. Muscle develops from the mesoderm. As these somites line up along the spinal cord, the attachments to the cord develop as well. Muscles innervated by a certain nerve will develop along with the nerve development in the spinal cord. This is the dermatome pattern that is so important in clinical medicine. A medical condition known as myelomeningocele occurs when the caudal end of the neural tube does not close all the way prior to birth. This leads to the spinal cord being open to the external environment and is not compatible with life. Surgery must be done within the first 24 hours of life to close the spinal tube. These children develop motor and skeletal problems below the level of the myelomeningocele. This ends the video on the embryology of the nervous system.